Today, we are going to talk about histamine intolerance, a condition that often flies under the radar in conventional medicine and sometimes even in functional medicine, but it could be an explanation to some of the frustrating symptoms that you may be having, such as chronic headaches, mood changes, skin troubles, and digestive issues. So in this video, we are going to break it down so that way you will be able to determine if histamine intolerance is something that is affecting you and how to treat it so that you can start feeling better. So before we get into histamine intolerance, I want to talk about what histamine is and what does it do. So histamine is a chemical that is produced by our bodies that will affect our immune system, our digestive system, and our brain. There are different receptors, and histamine can bind to these receptors, and depending on which receptor it binds to will produce a particular response. There are 4 types of receptors, so I'm going to go through those now. So the first one is the H1 receptor, which is primarily found in our immune system. So our immune system is constantly surveilling to make sure there are no foreign invaders in our bodies that it might have to attack to protect us. So there are particular types of immune cells called mast cells and basophils. These are cells that will release histamine when they detect that a threat is present. So when your body gets exposed to an allergen, for example, it'll trigger the mast cell to release histamine because it determines that that allergen is foreign and it's going to harm us, so it wants to protect us. What happens then is histamine will bind to the H1 receptor. Histamine will then cause the blood vessels, the tissues that are being invaded to swell. It'll dilate the blood vessels so you have more blood flow, so that way all these nutrients and more immune cells and even substances to help repair any injury will flow through. And because of that, you'll get some redness. And you will also get itching. Itching is also a protective mechanism because itching allows you to scratch off if there's any surface invaders on your skin and may also further trigger more immune cells. So all of this is supposed to be protective. But what happens is if you have an overload of histamine, let's say you have severe allergies because your immune system is overworked or you have autoimmune disease, then that system is overreactive and you will have a flood of histamine and have more severe symptoms. There are also some people who have something called MCAS, mast cell activation syndrome, where they have an unusually amount of dumping of histamine when they come into a foreign invader that's not just an allergen, but infections, even environmental stimuli, like if they're too hot, and many other triggers. And that can be a problem because it can lead to pretty uncomfortable symptoms. The histamine is binding to these H1 receptors and it creates this flood of response. Now, you may have heard of antihistamines, and this is a receptor that antihistamines such as diphenhydramine, which is Benadryl, or the prescription hydroxyzine, and this medicine blocks the H1 receptor, so histamine can't bind to it and it can't cause these swelling, itching responses. The H1 receptors are also located in the brain, and in the brain, histamine keeps you alert. And so if you have too much histamine in the brain, it can even cause insomnia because histamine plays a role in your sleep-wake cycle. It's supposed to keep you awake, but you don't want it there all the time. You want to be able to sleep. But if you have too much histamine, then it can cause insomnia. It can even cause anxiety. So hydroxyzine, for example, we also prescribe it for anxiety and insomnia for this reason, because it blocks that H1 receptor, allowing you to feel drowsy. And this is why antihistamines make you drowsy and allows you to sleep and helps your anxiety. You also have H2 receptors, and H2 receptors are found in the gut. And in the gut, when histamine binds to these H2 receptors, it stimulates stomach acid, so you can break down your food products and digest them, especially protein. However, if you have too much histamine, then you end up getting acid reflux, heartburn, nausea. So you may have heard of famotidine or Pepcid. which is an H2 blocker. So it blocks this H2 receptor in the gut, and that's how it lowers heartburn. You also have H1 receptors in your gut too, which can cause swelling, diarrhea, and bloating. There are also H3 receptors, which are primarily in the brain, and it plays a role in our neurotransmitters and cognitive function, but it is not as sensitive in regards to histamine intolerance. You also have H4, which is found in your immune system, and it also plays a lesser role in histamine intolerance. So next I'm going to talk about what are the two mechanisms as to why somebody may have higher than normal levels of histamine. So the first one I already touched base on when I talked about the H1 receptors and the immune response. So you have these mast cells and basophils, which are immune cells that are constantly looking, searching for foreign invaders. When they suspect a threat, then they tend to release these granules that have histamine. And if you have a normal immune system, this is a good thing because you do want some inflammation. Some inflammation is good, a lot is bad. But if you have an overactive immune system where you have severe allergies, this can be dangerous, can even lead to anaphylaxis and death, unfortunately. So the other way that histamine stays in your system at higher than normal levels is because you lack the enzymes to break down histamine. You see, there are certain foods that when they're broken down, they contain histamine, and that histamine has to be processed in our gut, but if we don't have enough of the enzymes, then you're going to have higher than normal levels of histamine, and that can cause symptoms. Those enzymes are diamine oxidase, DAO, which is the main one, and then the other one is histamine and methyltransferase. That enzyme actually adds a methyl group to the histamine to neutralize it. This plays a big role in histamine intolerance because breaking down your histamine so that it can get excreted is very important to prevent these symptoms. The DAO enzyme is found primarily in your gut. The HNMT, or histamine and methyltransferase, is found in other organs and typically manages the histamine that's circulating already in your body, whereas the DAO tends to manage the histamine that's coming in through your GI tract. So those are two ways that histamine can increase in your system. All right, so what are some symptoms that might indicate that you have histamine intolerance? So some symptoms can be digestive symptoms. If you have bloating, you have abdominal pain, you have diarrhea, acid reflux, nausea, vomiting. You also could have skin reactions. So you might have chronic hives and you're breaking out in these unusual rashes. You might get flushing, especially after eating, or just redness for no reason, especially around the face and the neck. You might have a non-allergic swelling of your lips, your eyelids. Your lips might just swell, but you're not swelling in your throat or anything where you're worried it's an allergic reaction. You may have runny nose, nasal congestion. You also can have symptoms that affect your brain, such as cognitive dysfunction or brain fog, insomnia, anxiety. You might have chronic headaches. You could even have menstrual migraine. So one interesting fact is when your estrogen is higher during your menstrual cycle, histamine levels also increase. And so this is why some women may get headaches, bad migraines, right before they're about to start their period. Histamine can also affect your mood, so you may even get a lot of irritability. And then once you have your cycle, the estrogen drops and symptoms go away. So this is kind of interesting because if you do have these symptoms, you might even consider taking an antihistamine because that might even help some of your symptoms. But of course, don't drive on them because they will make you sleepy. Histamine can also cause low blood pressure and rapid heartbeat. Causes you to have histamine intolerance. Most cases of histamine intolerance are acquired, meaning that there's no genetic link, that you just get it because there is something that goes awry in your body that reduces the DAO or diamine oxidase enzyme. So a major cause of this is gut dysfunction. And the number one cause is something called SIBO, which stands for small intestinal bacterial overgrowth. So normally you have your gut microbiome, which is something that is supposed to help you, but it is supposed to reside in your large intestine. You have fewer of those bacteria in your small intestine. You don't have very many, actually. And if you're interested in SIBO, I do have another video on that, so you may want to watch that. But When you have this excessive bacteria, it causes more bloating. These bacteria can damage the DAO enzyme so that it can't break down the histamine that you're getting from your foods. SIBO can also cause inflammation in your gut and lead to something called intestinal permeability, or more commonly known as leaky gut. And I do have a video on that as well if you want to learn more about that. But other things can cause leaky gut even aside from SIBO. Any kind of gut dysfunction can put you at risk for that. In leaky gut, your intestinal cells are usually close together. They're tight so that things that are small and micronutrients can get through the cell. But something happens where those junctions go apart, and as a result, histamine can get through those cells and get into your bloodstream, and then that can trigger a whole host of symptoms. And then that can bind to other receptors that are outside the gut that will trigger that histamine response. And then in your gut microbiome that's in your large intestine, you also want to make sure it's in good balance. You want to make sure you don't have something called dysbiosis, which is where you may have an overgrowth of less favorable bacteria that can cause problems, because those bacteria can also further degrade the DAO enzyme. Other things that can cause the degradation of this DAO enzyme is candida overgrowth, mold overgrowth, stress, because stress causes inflammation. Non-celiac gluten sensitivity is also associated with histamine intolerance. Now, there can be genetic predisposition to histamine intolerance that does exist, but it's rare. You have this genetic predisposition, but it doesn't express itself until you have some kind of insult to your gut that causes the degradation of these DAO enzymes. So that's why, children, if they have this genetic predisposition, may not have any issue until later on when their gut just goes awry. How do you know if you have histamine intolerance? Well, unfortunately, there isn't any really good blood tests to determine. There are blood tests for histamine, but if it's normal, histamine doesn't always stay around the blood very long. But if it's normal, it doesn't completely rule it out. If it's high, it might give you an inkling that something is going on. Either you have an overproduction of histamine or you have less of an enzyme to break it down. There also is another test called tryptase. Tryptase tends to be higher if you're having a flare of the mast cell activation syndrome, and it will be consistently high if you have a rare condition that can be very severe called systemic mastocytosis. So it might be worthwhile to get those tests done just to make sure that you don't have those issues, because the treatment may be different than just having a histamine intolerance to where you don't have the enzyme to break down histamine. You also can do allergy testing to see if your itching, swelling symptoms are due to food or environmental allergies. One way that you can tell if you have a histamine intolerance, assuming the allergies, the MCAS, and other more serious conditions are ruled out, is by going on a diet that is low in histamine foods. There are certain foods that contain an amino acid called histidine, and histidine then gets converted to histamine. You want to avoid these foods and for at least 2 weeks and see, do I have less headaches? Am I less itchy? Am I not breaking out in rashes? Is my digestive system better? And then you may have to avoid those foods for a little longer, not permanently, but just until you can fix the underlying cause of your histamine intolerance. Foods that tend to be high in histamine are a lot of healthy foods, which is unfortunate, and a lot of probiotic foods that are good for your gut. This is why in functional medicine we don't say one diet fits all, because it's very individualized. Some people need fermented foods, need things to improve their gut, and other people, if they have histamine intolerance, for example, or SIBO, that actually can make it worse. So it's very important that you work closely with your functional medicine doctor, and if they have a nutritionist that works with them, to work with them so that you can get a nutrition plan that is specifically tailored for you. High histamine foods are things like fermented foods, so kombucha, kimchi, sauerkraut, aged cheeses. The reason being is these have bacteria in it, and these bacteria, if your gut is not healthy, can degrade those DAO enzymes and it can inhibit it. You want to avoid certain vegetables such as tomatoes, eggplant, spinach, and fruits like bananas, as they tend to have higher levels of histamine. Avocados, which are normally pretty healthy, but if you have histamine intolerance, you also want to avoid alcohol because alcohol actually inhibits the DAO enzyme. So even if you have enough, it is going to suppress it, thus leading to high histamine levels. So one clue is if you drink wine, especially red wine, and you get flushed afterwards, or you get itching, or you get a headache, then you may have histamine intolerance because the alcohol is inhibiting that DAO enzyme. Also, fish can also suppress that enzyme. And fish, the longer it sits, so especially like canned fish, smoked fish, those have higher levels of histamine. Vinegars also can have higher levels of histamine. You want to avoid eating leftovers. And some people are screaming for joy right now because they don't like leftovers. So there are some fruits that don't actually have histamine in it, but they can trigger your mast cells to make more histamine. And those are strawberries, citrus, such as orange and lemons. And then there are some other foods that have some histamine in it that you do want to try to avoid for a short period of time. Those are things like pineapple, papaya, nuts, especially walnuts and cashews, and shellfish. So in summary, there are basically 3 ways food can affect your histamine levels. One, by eating away at that enzyme or inhibiting the enzyme, by triggering your immune cells to make more histamine, and by being naturally high in histamine. There are also certain medications that can affect your histamine. Most notably are NSAIDs. So these are things like ibuprofen, naproxen, and there are a bunch of prescription ones. Also, certain antibiotics, Augmentin, which is amoxicillin and clavulanic acid, that can also increase histamine. And there are many other meds, but certainly, if you're on a medication, you don't want to stop it. You definitely want to work with your doctor. So in addition to avoiding all those foods, you also want to work on improving your gut health. And so in general, we use what's called a 5R approach through healing your gut. And I do have some specific videos on those if you want to watch those. But basically, we want to remove anything that's aggravating your gut. So this would be any infections that's causing inflammation. You want to remove stress because stress also causes inflammation. You want to remove these triggering foods, such these high histamine foods. You want to replace any digestive enzymes so that way you're breaking down your nutrients while you're getting your micronutrients. Vitamin C and magnesium help stabilize your immune mast cells. You also need vitamin D for your immune system. And then the B vitamins, zinc and copper help that DAO enzyme and the NMMT enzyme. It helps optimize it so that you can break down your histamine more efficiently. So the other step is then we work on reinoculating by getting your good bacteria in balance. And then we work on repairing your gut lining, and glutamine is a very good supplement to help repair your gut lining. We might put you on some anti-inflammatory supplements such as turmeric, which is excellent for reducing inflammation. There also is quercetin and NAC that help stabilize your immune system. That will further help repair your gut in the long run. So, you definitely want to work with your functional medicine doctor to decide what you might need. And so as you improve this underlying cause, then your gut lining gets healed up. You start making more of these enzymes that can break down histamine, and your symptoms improve, and then you feel better. All right, so that was basically histamine intolerance, and I hope I gave you some information that's useful for you. If you're experiencing any chronic symptoms that haven't been explained as far as what the underlying cause is, then you might want to look into histamine intolerance, as it may help you feel better. If you like this video, please like, subscribe, and share with anybody that you might think might find it useful. I will see you next time. I hope you have a fantastic day.